Okay, so this is a view of the Xcite Health EMR. We're already checked in. Let me just log off for a second so we can pretend we're walking into an exam room. This is what you'd see on the computer screen. You click here and put in your little passcode, and now you're into the view. And we're looking at the waiting room first, where we can see there are two patients waiting, Peter and Teresa, who I guess are brother and sisters. They have the same last name here. What I'm going to do first is do, just so you see it, a little bit of what the nurses typically see, sort of pretend to be a nurse for just a couple of minutes, and then we'll do the doctor part, which I think is more what we want to concentrate on, but that way you'll see where the information comes from that the doctor will see. So the nurse will bring one of these patients back. Let's start with, let's do Teresa, I think, if that's okay, and we would be in one of the rooms. Let's say we're going to start with exam room 3 here. When the nurse walks into the room, she would have seen this screen first, this empty screen. There's no patient currently here. Get patient. Let's bring back Teresa. And the next screen that comes up asks for what you would expect the nurse to take first, the chief complaint and some other information. So we'll say chief complaint is, let's do bee sting. Over on the left here, there's some very common words that can be quickly chosen. If instead of bee sting you wanted to say they've had a fever, perhaps for 7 weeks, that sounds a little silly. Let's change that to 7 days. You could do that. That will sort of automatically populate here. 7 days onset, like that. So for people who don't like to type a lot, you can just start with this list. This is one of many, many lists throughout this EMR that's entirely user configurable. Those of us who type tend to not use these lists as much, but many people don't type as well, and they like to rely on these. So you could say fever beginning 7 days ago, and for instance, sore throat, let's say that began 1 day ago, and then you've had vomiting, that began 3 hours of the last 3 hours duration. So that was pretty quick, but again, I don't want to focus too much on this screen. This is usually information that the nurse will put in, and you can see how quickly they can generate a nice chief complaint. This got a little bit complicated. Let's take out some of this. We're just going to say fever and sore throat. That sounds like a good chief complaint. Okay. And then we also have our nursing staff collect the basic vitals. Let's see, this is a 15-year-old, so we'll make her a nice 130 pounds and 62 inches. You can configure this in metric for those of you who prefer. We typically would then do a temperature. We're sort of still wedded to the English units here, and a blood pressure. Anyway, I'm going to skip some of this now. We also added this recently back in January, February, when there was concern about Ebola virus. We added in a section where our nursing staff was taking out information about foreign travel and exposures. So would have put something like that: no travel to West Africa, or no foreign travel in the last month. We added that in there. Okay, so that's the chief complaint screen. We then have our nurses go through a list of the medications that the child is taking. This will include medicines that we've prescribed or medicines that were prescribed elsewhere. Now, ironically, as sometimes happens with test patients, it looks like Teresa was already seen with strep throat a couple of days ago, and I went ahead and gave her a sore throat and fever today, but that's just really a coincidence. This was reflecting this last visit where she was evaluated for seizures and for strep throat and was prescribed amoxicillin and is taking Keppra as well. The nurses then ask about allergies at every visit. We can see that she, in the past, was noted to be allergic to sulfa medications, and notes the severity and what the reaction was there. The nurse at this point in area just confirm that, and if the family says yes, that's still true, we click one-click reviewed, and that adds a little note. This next thing is, I don't know that many of the practices have done this. This was our own little homegrown little screen that we put into the sick work plan. What we were trying to do is capture children who hadn't had a well check in a long time. And this is just a very simple screen, but it pops up and the nurses see it, and it says, on this case, with Teresa patient, has not had a well check at our offices. If she had had a well check within the last year, it would say the date, had already had a well check, lotted on, put the date. But since she hasn't, it says, please suggest parents schedule a well check. If parent wishes to schedule a well check, click here. So the nurse now at this point could have said, oh, I see you haven't had a well check at our office. Would you like to schedule one of those? And if the parent says, no, thank you, that's fine. But if the parent were to say, yes, we'd like to do that, what the nurse would do is click right there where it says here. and this sends a little message to the administrator at the front desk to offer to schedule a well visit. And we'll see what that looks like after the patient checks out. So we sent that over. Now this screen, I don't think that's a standard part of the EHR, but it's just an example of some of the things that we've done at our practice. In this case, specifically to increase visits and to make sure kids come in for those well checks. Okay, finished. We're done with that screen. What would happen next is actually this. You saw that preview popped up because I was acting like a nurse, but ordinarily a nurse would do that, and now the nurse would now have left the room, and the patient waits for just a few minutes, and now I've walked into the room, and now I check in, and I see this. This is the screen I'm looking at when I check in to see Teresa patient. See that green bar up there? That was that offer to schedule well visit that I sent. In our office, green means something for the front office staff to do. This blue color is my personal color. This is Dr. Roy. This is me. This is something for me to do. And one of the super strengths, I think actually really the thing I like most about this EHR, the biggest strength, is exactly what you're seeing here, that at just a little quick glance we can tell what has to get done and who's supposed to do it. So someone at the front is supposed to offer to schedule a well visit, and I'm supposed to look at this preview view. And we'll have other examples. I'll put up a couple more services so you can sort of see what the power of this is, that multiple people can actually help out Teresa and do things at the same time efficiently. I don't have to wait to get out of the room to tell the nurse something. She actually knows what I need to get done as soon as I think about it, and she can start working on it. Okay, let's continue with the visit with Teresa. And by the way, for those of you participating, I don't see from the view I'm looking at, I can't see the chat screen or the Q&A screen. But I believe if anybody has any questions, you could just speak up and interrupt me. I know I might go fast, so if you want me to clarify, please speak up.
Yeah, I'll be monitoring.
Okay,
I'll be monitoring the chat, and
yeah, you let me know because I realize I don't see that other screen. I just see my office view. Okay,
yeah.
So let's do this. Here's the first thing that I see when I go in. I see this preview, and there's my nurse's chief complaint that she took a few moments ago, fever beginning 7 days ago, and the vital signs are here. That comment about the no foreign travel. Underneath here, it shows open prior diagnoses, and that includes the strep and the epilepsy that she had been in here for a few days ago. This closed sick diagnoses here would be things that she was seen for in the past at our office, but were closed. Closed diagnoses are things that are really no longer relevant, like an ear infection 2 years ago, or that she broke her toe last year or something like that. Those are still in the chart, but we refer to those as closed diagnoses because they're not active. They're not really at the front of our minds right now. So I've looked at our preview, and I click Finished. And here we're going to get sort of what you'd think of as the chart view. This is the main central view of this of Teresa patient's chart. It shows some of the same information you've seen before. The things in blue here are what is happening today. Okay, this is today's child vitals, and we've already gone through those. You can also see the past strep and the past seizures here. What else is useful, right? At first glance from this screen, see how the word allergies is in red here. That's just an extra clue you in that there's a drug allergy. We can also see it here on the assessment list. They're allergic to sulfa. In pediatrics, we're very, very keen on vaccinations. At our practice, I don't know that everyone else does this, but we like to at least briefly review the vaccine record at literally every visit, including every sick visit. The fact that this word VAC is in red tells you that this particular child is overdue for some vaccines. And for the details, we could click on it. Now, this is a test patient. Let's look at the detail. Yeah, this test patient, we've never actually entered an immunization record. I think I have another patient maybe we'll do a well encounter on a little bit later, and I'll show you something more useful. Of course, as far as our computer knows, Teresa does need vaccines today, but we just hadn't set her up for the test patient. So we could talk about vaccines with the patient if she was really due for them, or we could launch into talking about the chief complaint. I'm going to now show you what I would do next for what's called the provider work plan. The part that I do starts here. This is a sick encounter, so I click the sick visit. This is the past medical history from before she joined the practice. If one thought to review this, you can review it. You can add more information there if you want to as well. Now I'm going to take our ROS. We call it the review of systems with HPI. This can be configured as well for those of you who want to take a separate HPI and a review of systems. You could do that. We sort of mash it all together. There's multiple ways to do this because in our practice, some of the doctors like to type more than others. I will admit I'm a little bit of a typer, so I use this top one, this freeform one, and here I can type whatever I want to type. So has had a sore throat, ... I could also use these phrases over here. She's had no diarrhea, no vomiting, and no ear pain, for instance. Other physicians in my group prefer not to type quite as much, and they use these HPIs. So, for instance, the constitutional HPI here, this was set up to just yes, no. So no fever, no dizziness, no weight gain, no weight loss. And that shows the same information. It's just more oriented to physicians who feel like doing a little bit less typing. And this is all configurable by the practice. You can set up these HPIs on your own. Here's a URI HPI. In this case, yes to sore throat, no stuffy nose, no cough. And if you do get a sudden urge to type something, even from this screen, you could type as much as you want. You just click on this text button. So if you wanted to clarify sneezing, you could type in here only when around the cat or something like that. Okay, so that was our HPI. We're done. Now we've got our physical examination. And again, you have different ways to do this. In our practice, we've set up these what we call stock examinations. They're over here on the right. And we find that most children can have one of these stock examinations applied, and then you can tweak it to change what was relevant. As you can see, we have a basic exam, otitis media right and left, sore throat, cold, sinusitis. This stands for brief normal newborn. And there's a few others. In this case, we're probably going to do, let's just assume she had an exam consistent with a sore throat, pharyngitis. We click there, and it populates. And this shows, just as a for instance here, posterior pharynx is red. Let's say you wanted to add to this that she had, I don't know. Let's say she had big lymph nodes. Okay, so we're going to add that. We can go to the lymph node section here and type, for instance, she had abnormal anterior cervical lymph nodes. Okay, and you could put more details in there about the size if you wanted to. Click, click, click. But you're done. And that was very, very fast. Now we come up with our assessment. And at this point, we know she has a sore throat. You know what? Let's pretend that she wasn't here a few days ago with strep throat, because medically speaking, that kind of makes this an unusual visit. Let's say this is a new visit and she hasn't had a sore throat. We're going to diagnose her with. We haven't done our strep test yet, so we're going to diagnose her with not having strep, and we're going to order a rapid strep test. I'll show you what that does. Symptomatic treatment. Go gargle with some warm salt water, and we're done. That's really all we need for a sore throat visit. We're going to have the nurse do this rapid strep test. Let me show you what that means. We made our diagnosis, we ordered our things, and in our work plan, it forces you to choose something about the follow-up. We thought that this would help fulfill insurance company requirements, so you can choose follow-up as needed, follow-up if new concerns, or actually schedule a specific follow-up. Let's just say follow-up if worsened persists. That's good enough. So here's today's chart. We're actually done with our charting, and it shows our review of systems here and our physical examination here. Look at that one thing. There's one service, though, that's highlighted. It's right here. This is the one that we still need our nurses to do, and this is what I meant when I said that business about the work plan, about all of the employees in the building helping out and doing their jobs. We think we're done. I'm going to click Exit. I can review my billing here. We're going to bill at 213. There's our diagnosis. We did the strep test. Yep, that looks right to me. In all honesty, I usually don't even bother to look at this because it's usually correct, and I'm finished. And now I'm ready to go to the next room. I'm ready to see my next patient, but there's some things for my staff to do. In green, somebody wants to offer to schedule that well visit, and in pink, there's do a rapid strep, because pink is the color that my nurses use. When they see a pink bar, they know they have to do something. So I can leave the room. The nurses see the pink bar. They click on it. One nurse can go and collect it. And this has to do with leaving the results of the throat culture. That's a little thing we like to know if we can leave it on their answering machine. We added that to this template. And then another nurse, 5 minutes later, ding, 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 5 minutes went by, can go in here and put in there that it was negative. And they're done. If it was positive, my nurses will put up a blue bar saying strep test was positive, go back and write for some antibiotics. And I'll see that before I go in to see the next patient, and then I'll go back to Teresa. So that visit, I did a fair amount of talking, I know, which really slowed me down, but a good sore throat type of visit like that to do all of the charting would be, I don't know, 45 seconds tops or something like that. And not only did I get a good note that's medical legally appropriate. It's got all the medical details that my partners might need later on. It generated a good bill, and it told all of my staff what they were supposed to be doing all at the same time. And Teresa's happy, and my staff is happy, and I'm happy because I get to go see the next patient. Okay, let's do that. Matter of fact, let's do this. Before we go to the next patient, telephone room, that's lit up. It's in red because I have a phone call. So as you know, in pediatrics, we get a lot of phone calls. There's one in pink that says, please call mom. That means that that's pink is still the nurse color. The nurse is supposed to pick that off and call the mom. But I've got one in blue. So I can answer this phone call very quickly in between patients. I don't know what this is. Question about meningitis. I click on it, and it says here, child with meningitis at tomorrow's school, does she need to take antibiotics? So I might put in an answer. You know, I need to get more information. In this case, what kind of meningitis? But I would put in an answer, just for instance, yes, does need antibiotics, let's just say. And then, in fact, I could very easily go into the chart here, and I could make a new diagnosis of exposure to, we'll call it exposure to communicable disease, right there. And, you know, I haven't used this diagnosis a lot. When you use them, there's some pre-populated things here, the stuff that you usually use for this diagnosis, but we don't have one here, so I'm going to put this, how old is Tamara? She's 6 years old, so we would put her on Bactrim. I'm just going through this quickly. There you go. I don't know that I picked the right dose, but I picked a dose. And then I can confirm it. Wait a minute, that's not right. I want to do a different dose. But we'll leave it at this just for the sake of this example. Let's make it BID. Okay, good, finished. And now the nursing staff knows, call in med, and I'm done with my phone call. And now there's no more blue bar here. I did my part. Now instead of a blue bar, there's a pink bar for the nurse to call them back to tell them they have to take their medication. Now we set this up as a test room, so I guess the SureScripts didn't work. Typically there's a little white box here where we don't see there. It says manually print this prescription. Usually that won't pop up because we use SureScripts to send scripts electronically. And you'll just have to imagine with me, I guess because this is a sort of a test situation here, the Xcite didn't set me up with so you can see the SureScripts. But you would click right there, and then you'd pick their pharmacy, and you'd click send, and that's what you would have to do.